red blood cell abnormalities. When a red blood cell is not round or biconcave disc like so, it will be called coikilocytes, which is actually another name for an abnormal red blood cell shape. This abnormal RBC can be various shapes such as a teardrop shape, oval, or irregular shape. Some example of poikilocytes are such as acanthocytes, elliptocytes, but today we are going to talk about dacryocytes. That is actually comes from the Greek word dakryon, which means tear. So another common name for dacryocyte is actually teardrop cell. They are abnormally shaped red blood cells that resemble a teardrop or pear shapes. This abnormal shape of red blood cell can be found in various conditions such as thalassemia, sickle cell anemia.
Hi, my name is Jane, and now I'll be talking about the morphology of dacryocyte. As you can see here in the picture, this is a picture of a blood smear under a microscope. Just like what Farhana has presented just now, a dacryocyte, they have a thin tail-like projection at one end, which makes it look like a teardrop. In dacryocyte, the membrane is damaged. Now, let us compare the morphology of a dacryocyte and a normal erythrocyte or normal red blood cell. The shape of a normal red blood cell is a biconcave disc with a flattened center. Both faces of the disc have shallow ball-like indentations, just like what Farhana has presented just now. The shape will look like a donut. However, we have to beware of artifacts. When we observe a blood smear which contains dacryocytes, we have to observe where the tails are pointing at. If all the tails are pointing to the same direction, then it is most likely artifact, which means probably incorrect technique used, etc. However, if the tails are pointing at all directions and not only at one direction, then it is an indicator of a disease or a condition.
Next, I will continue about the etiology of the dacryocytes. So, teardrop cell or the dacryocytes are frequently associated with infiltration of the bone marrow by fibrosis, granulomatous inflammation, or hematopoietic or metastatic neoplasm. They also can be seen in patients with splenic abnormalities, vitamin B12 deficiencies, and some other forms of anemia. And true teardrop cell have blunted tips and also point in different directions. Teardrop cell that occurs as an artifact or of blood smear preparation have sharply pointed ends that point in the same directions. The presence of teardrop cell may indicate anemia caused by bone marrow, which they are not producing not normal blood cells due to toxins or tumor cells.
Hi everyone, my name is Razina. Me and Hannah will be presenting about the associated disease with dacryocyte. Here I have listed out 6 diseases that are associated with dacryocyte. I will be explaining the primary or secondary myelofibrosis, beta thalassemia, infiltrative disorders of the bone marrow such as leukemia and lymphoma, and finally hemolytic anemia, which include AIHA, MAHA, and hereditary spherocytosis. Meanwhile, Hannah will explain about the megaloblastic anemia and myelofibrotic anemia. I will start with the primary myelofibrosis. This disease is chronic idiopathic myelofibrosis, which is known as an uncommon bone marrow condition that is categorized as an myeloproliferative neoplasm (MPN). It is caused by an abnormal buildup of fibrous tissue in the bone marrow, which reduces the marrow's capacity to create healthy blood cells into the bloodstream. This makes the erythroblast to undergo mechanical stress as they move through the bone marrow's fibrous network, which causes them to change into dacryocytes. Next is the secondary myelofibrosis, which is known as post-polycythemia vera myelofibrosis, PPV-M PEMF, or post-essential thrombocythemia myelofibrosis, which is known as PET-MF. It is a disorder that develops as a progression of previous myeloproliferative neoplasms, such as essential thrombocythemia when the bone marrow produces too many platelets, or polycythemia vera when the bone marrow produces too many red blood cells, leading to a thickening of the blood. In PMF and SMF, there is a clonal proliferation of abnormal hematopoietic stem cells, which leads to the excessive production of megakaryocytes. Megakaryocytes means large bone marrow cells, which is responsible for producing platelets. These unusual megakaryocytes will produce a variety of cytokines and growth factors, which cause the bone marrow to accumulate collagen and fibrous tissue. Moving on with the second disease, which is known as beta thalassemia. Beta thalassemia is a hereditary blood illness characterized by decreased or non-existent synthesis of the beta globin protein, which is known as a component of hemoglobin, which is in charge of transporting oxygen in red blood cells. It is brought on by changes in the HBB gene, which codes for the beta globin protein. Basically, beta thalassemia is characterized by poor erythropoiesis, and the occurrence of dacryocyte is most related to this characteristic. In beta thalassemia, there is an imbalance in the formation of alpha globin chains due to the absence or diminished production of functional beta globin. Due to this imbalance, there are too many unpaired alpha globin chains, which build up inside of red blood cells as aggregates and harm the cell membrane. There will be anemia and inefficient erythropoiesis as a result of the damaged red blood cell being trapped and destroyed in the spleen. Next, for the third disease is infiltrative disorders of the bone marrow, which involve leukemia and lymphoma. Leukemia is a kind of cancer that affects the blood and bone marrow, the spongy tissue inside bones where blood cells are made. It includes the excessive production and buildup of abnormal white blood cells, which obstruct the healthy blood cells' ability to function normally. There are 4 types of leukemia, which are acute lymphoblastic leukemia, ALL, acute myeloid leukemia, AML, chronic lymphocytic leukemia, CLL, and finally is the chronic myeloid leukemia, CML. The differences between these categories depend on the particular cell type involved. Either it can be lymphoid or myeloid, and whether the disease advances quickly or slowly. Depending on the exact subtype and stage of the disease, a variety of factors may contribute to the development of dacryocytes. Dacryocytes are frequently found in leukemia at an advanced stage and might mean the illness has affected to the bone marrow or caused bone marrow fibrosis. For the lymphoma, it is known as a type of cancer that affects the lymphatic system, which is a part of the body's immune system. It develops as a result of unusual lymphocytes, a subset of white blood cells that are crucial to immunological response growing out of control. Hodgkin lymphoma (HL) and non-Hodgkin lymphoma (NHL) are the 2 primary types of lymphoma that can develop. Usually, dacryocytes are relatively uncommon in lymphomas and are only seldom found in particular circumstances. Next is the hemolytic anemia. This disease is the premature breakdown of red blood cells in the blood or the reticuloendothelial system, which includes the spleen and liver. In hemolytic anemia, red blood cells degrade more quickly, which shortens their lifetime and lowers the quantity of circulating red blood cells. This can result in anemia, a condition characterized by a decreased number of red blood cells or a reduced ability of red blood cells to carry oxygen. So in this disease, there are two types of hemolytic anemia, which are intrinsic hemolytic anemia and extrinsic hemolytic anemia. Intrinsic hemolytic anemia is caused by abnormalities in red blood cells, which include genetic disorders such as glucose 6-phosphate dehydrogenase G6PD deficiency, thalassemia, hereditary spherocytosis, and sickle cell anemia. Meanwhile, extrinsic hemolytic anemia usually develops due to factors external to the red blood cells. The causes includes autoimmune disorders, where the body's immune system mistakenly recognizes the red blood cells as foreign and attacks them. Other than that, the causes includes infections, certain medications, transfusion reaction, and mechanical damage to red blood cells caused by heart valve or artificial heart devices. That's all from me. I will pass to Hannah to present her part.
Moving on, there are megaloblastic anemia and myelocytic anemia. Megaloblastic anemia is a type of anemia characterized by a presence of large, immature, and dysfunctional red blood cells that are actually called the megaloblasts in the bone marrow. It can be caused by the deficiencies in vitamin B12, vitamin B12, or folate, vitamin B9. While myelocytic anemia is a type of anemia caused by the replacement of bone marrow by abnormal cells or tissue, leading to impaired red blood cell production. In brief, as the abnormal cells or tissue infiltrate the bone marrow, they disrupt the normal hematopoietic process, leading to the decreased production of red blood cells, white blood cells, and platelets.
Good morning, sir. I am Alma Maisara, and I will be talking about the possible treatments. So since this condition is associated with anemia and also thalassemia, so these are the possible treatments that can be done to treat this condition. So first is blood transfusion. Blood transfusion can increase a person's hemoglobin level and directly increase their oxygen level. Second is bone marrow transplant. People who experience this condition, they might not produce a good quality or a normal blood cells. So they produce abnormal white blood cells, red blood cells, and platelets. So this condition might also be associated with cancer and toxins. Next is taking supplements. So taking supplements like vitamin B12 is important because it increases the iron in the body. And also the next treatment is to treat underlying chronic diseases. Next, I will be talking about the risk factors of this condition. So risk factors are those people who might have a higher possibility to get this condition. The first risk factor is family history. Those family who had backgrounds of having this disease might have a higher possibility to get this condition. Next is a diet lacking in vitamins and minerals. So all of us know that vitamin B12 is significant for iron. So if a person is lack in these vitamins in their diets, they are more prone to get this condition later on. Next is chronic conditions such as autoimmune diseases. Regular blood donors. So basically, regular blood donors will often lose their iron, so they have iron deficiency later on in their life. Next is adolescents. So adolescents, especially in female adolescents, this is because they have menstrual cycle. So when they're having their period, they tend to lose more blood, and when they're in that age, their iron intake is very demanded, and also their hemoglobin level is also very demanded. So these are the risk factors that have the higher possibility to get this condition because of their certain factors that contribute to the formation of this red blood cell shape. In conclusion, DACRYOCYTE is a disease where the red blood cells have the shape of teardrops, In addition, compared to normal red blood cells, dacryocytes are characterized by a larger size and it has a thin ridge that makes it look like a teardrop. There are a few reasons and causes on why this condition occurs. One of them is from the infiltration of the bone marrow by fibrosis. Some of the diseases that are associated with this condition are megaloblastic anemia and myeloplastic anemia. The treatments that are possible will be blood transfusion and also bone marrow transplant. The risk factors include those who have family history experiencing this condition and those who have chronic conditions. That is all from our group. Thank you, sir.